of the dental dam. Before you start this procedure, you need to have all your PPE on. Your gloves, your goggles, and your mask.
Okay, so for the dental dam procedure, there's specific materials that you'll be needing. A few of them are the dental dam napkin. You will need your dental dam material.
Does the material come in 2 different sizes?
It does. There are 6x6 dental dams, or there's also 5x5 dental dams. Today, the template that we'll be using that helps you to mark the teeth that you're going to be surrounding with the material is a 6x6, but since we have 5x5 material, we're going to be flushing it to the bottom. That way it leaves extra room from the mandibular teeth down so that the frame does fit correctly.
Okay.
Along with that, you will be needing, of course, your frame. You'll need your dental dam hole punch, your forceps, and along with that, your scissors. You'll also need your wedgette. You're going to need your floss or your safety line, and you will be needing petroleum jelly and a cotton tip applicator, and this helps with placing the petroleum jelly on the opposite end of the dental dam that you'll be working with so that it does make placement easier and it goes down over the teeth smoothly. Okay. So to begin the procedure, what you would do is you would use your template and you would make the markings of which teeth you're going to be surrounding on as far as your anchor tooth, which will be 2 teeth distal from the tooth that you're working on. And then when you've made your markings, you will use your dental dam hole punch to create the holes on the dental dam. The dental dam hole punch does have specific sizes. Depending on which teeth you're going to be working on, you would just put it into place for whichever hole you're going to be using. So I've already placed the holes, and we will be working, our anchor tooth is going to be tooth number 19, therefore we will be working on tooth 21, which is a premolar. So we've already placed the holes. After that, the first thing you would be doing is getting your safety line and attaching it to your dental dam clamp. For this specific tooth, since it is a molar, you do have to go according to the size, and there's an assortment of different sizes. So we'll be using the universal molar clamp. And when you're placing your safety line, you're going to place it around the bow of the clamp. Just like that. So there's different techniques as far as which way you place the clamp. Some people will place the clamp before they put it, before the dental dam material goes on, or some people will place it over the clamp and then place it all together as one, which is what we're going to be doing today. So you'll need to stretch your material over the bow of the clamp. And you'll always keep your safety line to the back, just like that. Then with your forceps, you will place the clamp on the anchor tooth, which, like I said, is going to be tooth number 19. And when it's on, you will pull the material carefully without ripping it over the wings of the clamp. Okay, so now that we have it over all of the teeth, we can use our mouth mirror to make sure that it is in between each tooth correctly. And it looks good. For the distal of the last tooth that you would be stretching it over, of course, across the midline, you would use your widget to go ahead and place in between.
And what is the widget used for?
It's used to stabilize the material from snapping out during a procedure. You can put it straight between. What I like to do is pull it over. That way you have extra support.
Okay.
So, since all the material is on, after that you would place your frame. And you are going to be placing the frame. In the book, it has it over the material. What we've done in class is put it under. I'm going to go ahead and just put it under like we did in class. It adheses to the dental dam with these little notches. And that is how you would place it. Of course, this is a 5x5, so it's a little bit shorter up top. We do have an example of the vinyl, which are obviously of bigger size. They're the 6x6, therefore they would completely cover the cavity.
Is there a certain way that we have to disassemble the dental dam placement?
When disassembling it, what you are going to do is you would take the frame off, of course, carefully holding on to it. That way it doesn't fling off of the patient's face. You can remove your widget carefully, making sure that you're not snapping it through the tops of their teeth. What you would then do is use your forceps to remove your clamp. And you can just place your clamp down. And for removing it, you would use your scissors for this part of the procedure. You would pull out the material from the interproximals like so. Carefully.
Do we have to start a certain way, or can it be from any way?
Usually you would start from the back.
To the front, okay.
So of course, carefully cutting the material, of course, not the patient. Well, like I said, the material does rip, so of course the closer you get to the edge of the material when you're removing it, it might just rip off, which makes it easier for you to take off. You would place the dental dam on the bib of the patient after removing. That way your dentist could examine the patient's oral cavity to make sure that everything came out correctly as needed. And that is it for the placement and removal of the dental dam.
Thanks, and have a great day.